Hello, my name is Taylor Line, and welcome to a presentation on my individual health education and promotion philosophy. Our central focus today will be on the rehabilitation specialist role that a background in health education and promotion supports. Further, the role specialty will prioritize a demographic of older women presenting with dual diagnosis. More specifically, this targeted population will be diagnosed with co-occurring chronic pain and substance use disorders that obtaining certifications like a certified addiction counselor and co-occurring disorder professional may significantly advance their understanding and supporting clientele through the intersection of diagnoses. In addition, it is pertinent that the rehabilitation specialists branch out to additional roles, like serving in a pain management clinic, for example, furthering their education in a graduate program and serving as a faculty member to not only continue their professional career, but remain involved and engaged in an ongoing knowledge attainment within their specialty field. In review of the monumental renovation occurring in behavioral health, we'll consider the modernization of rehabilitation and why specialized training is essential for the next generation of caregivers. On that note, we recognize that improving the quality of life for the individual as well as ensuring health equity is vital. Rehabilitation specialists working with dual diagnosis clientele aren't just seeking for individuals to maintain their sobriety, for example, but assist those help seekers in navigating a life beyond their diagnoses and restore their independence. What does regaining independence actually look like in practice for someone living with co-occurring disorders? Extending further than just did you go to your therapy session today to measurable improvement across all daily lifestyle aspects, like shifting out of inpatient treatment to coordinated independent housing, or even successfully managing their own budget. With the role underscoring the importance of coordinated and integrated treatment to increase long-term outcome effectiveness, rehabilitation specialists' daily routine exists among numerous tasks embedded in assessment, like evaluating a client's physical, mental, and emotional status and determination of need and eligibility for certain services, the development and implementation of individualized treatment plans, like when they often collaborate with multidisciplinary teams of psychiatrists, social workers, you name it, providing therapy and training, like with social skills training, and coordinating services, like offering ongoing guidance to set effective goals and connecting clientele with support in their communities. Treatment plans must include synthesized data from a multitude of sources, substance use disorder specialists, housing coordinators, mental health providers, to ensure that the plans remain coherent and person-centered. Managing the abundance of information from numerous sources oftentimes takes more than dedication, especially as we want to avoid providing any conflicting advice and guidance to clientele to ensure that clients remain engaged in their treatment. My background in clinical psychology has guided my understanding and the benefit of adopting a multidisciplinary approach in order to draw more insightful conclusions of specific intervention types and strategies that may better suit an individual client based on their presented needs. From this, my personal health education and promotion philosophy statement is as follows: to expand the comprehensive outlook on substance usage and addictive behaviors by educating healthcare professionals on ways to contribute to fields intersecting with public health and enhance holistic care for underserved populations. So, how do we actually prepare the next generation of specialists for this highly integrative, demanding work? Let's start with three supportive ways of not only educating students in the classroom, but guiding students to continue the stream of knowledge through hands-on experience they'll get and gain beyond their textbooks. Like with a dedication to serving a multitude of vulnerable populations, establishing and enhancing interpersonal and technical skills, and structuring health education interventions based on holistic needs. We'll begin with experiential learning, where students move beyond the classroom's walls and seek out those real-world opportunities through dedicating to serving a multitude of vulnerable populations. I will mandate that students complete a certain amount of community service volunteer hours each semester course. For instance, I would mandate that every student seek out and actively participate within their communities each semester with a 5-hour minimum dedicated to substance abuse and addiction specialties. That hands-on exposure underscores the significance of building relationships and rapport within the community served. This pillar emphasizes movement within various organizations as opposed to fulfilling the community service requirement in one place, as to better understand the scope of public health. Field experience not only allows for hands-on experience and obtaining in-depth insights into a specific concentration, but this experiential learning provides contextual understanding from navigating a desired career path. Diversification in curriculum may better equip students to reduce health disparities by addressing those clients' individual needs, in addition to establishing that inclusive environment that may aid in enhancing treatment outcomes. More specifically, this requirement will be a minimum of 15 hours of community service volunteering hours, with that 5-hour minimum of substance abuse and addiction sector requirement. This is where they're going to gather a variety of experiences with no student volunteering within the same organization for the entirety of this requirement. Next, why don't we touch on strengthening skills and self-efficacy, like establishing and enhancing their interpersonal and technical skills? I will assist students in developing and strengthening their interpersonal and technical skills to boost that postgraduate success. For example, I will create opportunities for students to engage with the material covered through introduction to educational tools and assessment measures like the opiate risk tool. Exposure to these psychometric instruments will contribute to their sense of self-efficacy in items they most likely will interact with in their internships, professional careers, and so on. But how do you practically teach a skill like empathetic tone? Through deliberate practice, using mock counseling sessions and role play. It's necessary to morph traditional passive lectures into coaching sessions where students are allowed time for practicing micro skills to the point of comfortable execution. Deliberately practicing when interpersonal skills could be observed through mock counseling sessions and role play between students. This could be observed as well as in hands-on workshops and seminars, like attending a naloxone demonstration or sitting in on a public court hearing prior or post-class debate. As we consider the necessary skills and expectations for the future of health education and promotion, we look toward a 2017 study addressing the reconfiguration of behavioral health roles as it highlights the significance of role standardization for paraprofessionals. The increasing demand for behavioral health services means relying increasingly more on paraprofessionals, but the role responsibilities and functions have not always been clearly outlined, which is where role standardization fits in to ensure that everyone is on the same page and it doesn't continue where one state expects specific functions from a counselor, while across state lines, the process could be drastically different. Now let's spend some time considering systematic thinking and person-centered design with structuring those health education interventions based on holistic needs. This is where I'll encourage students to utilize a person-centered approach to design individualized interventions. For instance, I'll require students to form groups for semester-long projects to be presented orally on a topic of interest that applies the socio-ecological approach to their targeted population/demographic. Students must be able to hone skills relevant to collaboration, public speaking, and critical systems thinking. But this pillar will bring it all full circle and address systems thinking as we're aiming to not only acknowledge the influential aspects of disease, but how these influences interact with one another. By recognizing the socio-cultural and emotional elements of a client's lifestyle, we'll be better able to equip students to graduate beyond symptom recognition to deeply understanding how to navigate early detection and coordination of care for their clients. Students will review current and ongoing research literature, prepare a mock clinical case conceptualization, and present orally on their findings. Approaching person-centered care and holistic needs of clientele may include consideration of dual diagnosis complications that encourage more integrative treatment. Utilizing a framework assessing multiple levels of influence for disease genesis and progression may increase confidence in navigating that early detection and coordination of care opportunity, as well as how to improve those quality of life outcomes for our clients. Moving past traditional sequential care to an integrated multidisciplinary approach to treatment is essential to mitigate complexities observed in dual diagnosis cases and boost client autonomy. With a foundation in evidence-based practice, the modern philosophy of person-centered care is rooted in harm reduction, motivational interviewing, and adaptability in how we address and approach complex psychophysiological interactions to go beyond those rulebook enforcements and prioritize improving one's quality of life in a way that best suits the client's needs. Rehabilitation specialists, by prioritizing dual diagnosis and individualized treatment, are essential for the understanding of addiction as a disease. In order to increase the likelihood of treatment adherence and long-term effectiveness for maintained behavior change, professionals working in fields relevant to substance use and addiction must consider the appropriateness of a multidisciplinary approach that allows for strategies personalized to the specific individual's presented needs. That being said, I will prepare the future of substance abuse and addictive field representatives to maintain dedication to public health through the development and enhancement of interpersonal and technical skill sets, exposure to a variety of community service opportunities, and establishment of holistic health education interventions. We've made it to the end where I've outlined all references cited within this presentation. Thank you for your time.